Welcome to the Seniors Flourish podcast, where it's all about helping occupational therapy practitioners working with older adults be the best they can be. And now your host, Mandy Chamberlain.
Hi everyone, before we get started, I wanted to talk about Seniors Flourish's sponsor, Great Seminars and Books. What I really like is that their mission is focusing on geriatric rehabilitation education and training for clinicians, which, as you know, is near and dear to my heart. They have great live courses focusing on topics such as clinical orthopedics, cancer rehab, or even topics such as clinical neurology. There is a course for anyone looking for evidence-based practice and treatment ideas while working with the older adult population. These are definitely some topics that I am interested in, and I think you should check them out too. So head on over to seniorrehabproject.com/great and use my promo code SRP25 to get $25 off your next course.
Hi, everyone. This is Mandy Chamberlain, your host of the Seniors Flourish podcast. I'm an occupational therapist, and if you're just joining us for the very first time, I run seniorsflourish.com. I also run the Learning Lab, which is a membership site for occupational therapists and occupational therapy practitioners working with older adults that are looking for treatment ideas and all sorts of things like that. But today, my guest is Mandy Perez. She's an occupational therapist and certified lymphedema therapist. And we are talking about edema and venous disorders and all sorts of things like that. I think it's kind of one of those topics that's kind of tricky for a generalist OT trying to figure out what's the best treatment ideas. What do we do for goal setting? Like, when do we refer? And so I think she is going to be an amazing wealth of information. And so I am very excited you are here today.
Thank you, Mandy. It's such an honor to be invited to speak with you and everyone. I'm really happy to talk to you guys about lymphedema and edema.
Well, it's one of those things like we were talking about before. How I found Mandy was that she made a comment. She follows me on Facebook, and she made a little comment in reference to one of my articles. Yeah. And so this is what you get for making a comment. And I'm like, who is this person? I like to know, like, who's following me. And I'm like, oh, I would love to talk to a lymphedema therapist. And so this is what happens. You start connecting, and I love, that's what I love about like social media. But anyway, so it's kind of funny how
Great.
I was hunting you down.
Love it. I'm glad you did.
Well, let's talk a little bit about like your OT journey and like, why did you decide to become certified lymphedema therapist?
Yeah, that's a great question. So ever since I was a teenager, about 14, I knew I wanted to work with older adults. My aunt was a physical therapist, so she invited me every summer and during the breaks to volunteer with her. And I'd kind of hang out with the older adults in the recreation department and the activity assistants. And she gradually introduced me to all her coworkers and OT, like a speech therapist, a PT. And I kind of combined my interest with gerontology. So I have a bachelor's degree in gerontology. So once I started learning about all the theories of aging and what the study of gerontology really is, which is just about promoting wellness and really like finding and equipping seniors with tools they need to age well, to age in place, to live life to the fullest despite any chronic illnesses or diseases or disabilities. Like, I loved how that just molded so well with what OT was all about. So that's kind of like how I became an OT. And then my first job out of grad school was at an acute rehab center in Largo, Health South. And I noticed just like all of my patients suffered from lower body swelling. And I was PRN at the time, and I really wanted to be full-time. And I kept getting passed up for full-time. It was kind of upsetting and disappointing. And the reason was, one of the reasons was because that area was very like popular. Largo was by the beach, great cost of living. And these people that were applying were all certified in something that the hospital really wanted, like either neuro One lady was certified in vision, another one was certified like a lymphedema therapist, a CLT. And I thought that was so interesting. I'm like, wow, I would love to help people with swelling. Like, it really does impact their activities of daily living. So I talked about it with the girl who got hired instead of me.
Oh, yeah.
And I'm like, well, what do you like about it? And she just like raved about her training and how she uses it, even with people that don't have lymphedema. Like, she'll use it post-operatively, like with her knee replacements. She'll work that into their 1.5 hours of therapy every day. So I knew, like, I wanted to pursue it, like, after I talked to her. So I did a year after. The money for the certification, it's like over $3,000. So
Oh my gosh,
it was
I had
something
no
like I
idea.
really, really had to want to do. And I only pursued it after I shadowed at an outpatient breast cancer clinic just to make sure like it was worth that time and financial commitment. And I decided it was, so then I went through with it.
Is it like a in person? Is it like a dual online in person, or how does that?
It's I completed my training through the Academy of Lymphatic Studies. There's like 3 or 4 other accredited schools. But so they send you like 40 or 45 hours of textbook and online homework and PowerPoints to complete, like self-study. And that prepares you for the intensive, like 10-day, 10-hour training that you go earn. 9 days in person, 10 hours a day, like classes, labs, practicing the manual lymph drainage techniques and the bandaging, and going really into depth about what the lymphatic system's all about. So, yeah, it was
and that's intense.
Yeah, I felt like I was in grad school all over again. It was incredible.
It is funny, like you say, like you get out of grad school and it's so intense in, grad school, and then you get into the real quote working world and it's different, and then jumping back in.
Yeah.
Oh god.
Yeah, it was a great learning opportunity though, like, because I just love to learn and like equip myself with knowledge, and in OT so great because there's always something new to learn, and there's always like research out there to.
What kind of setting then do you work in currently?
Currently I am in a private, very small, freestanding outpatient lymphedema clinic.
Oh, okay.
I work
specifically.
All we do is lymphedema. We also treat other types of swelling, like regular edema, status post, like knee replacement, shoulder replacement. We treat like breast cancer related lymphedemas or lymphedemas after cancer of the bladder, like the prostate, like lower body lymphedemas, even congenital, because some people are born with lymphatic systems that are not developed appropriately, and they are just like swollen at birth, or like their swelling will develop right after puberty. So we've had a few congenital cases as well.
Did not know that. See, that's why I love these podcasts, because I honestly learn something new all the time. That's yeah. So what are your typical types of diagnosis do you see in your setting? Like what is the most referred type of diagnosis?
Yeah, that's good. So 90% of our caseload suffers from venous insufficiency, or like chronic venous insufficiency, known as CVI. So really, that is caused by a combination of issues, but really, we live in a world full of gravity, like on Earth. So over time, and just living on Earth, and having the opportunity to live into an advanced age, the valves, the one-way valves that control like the flow of deoxygenated blood from your feet and legs back up to your heart, like those valves stretch out and cause the backflow and pooling of blood in your legs and feet. So that, combined with occupations of like prolonged sitting, prolonged standing, and like a history of DVTs, all those, and even like hereditary, women are more prone to it. All of those things cause people to develop venous insufficiency, like at very advanced ages, and even like 50s and 60s year olds. But a lot of my patients are like in their 70s and 80s.
Oh, they're funny, aren't
Yeah, I
they?
love them.
Well, obviously, I love working with older adults.
We also get quite a few referrals from breast cancer, like oncologists, so breast cancer-related lymphedemas, which are, lymphedemas affecting the upper extremity. Usually it's like one or the other, the one that's had the most lymph nodes removed and like radiated. Every once in a while I'll get lymphedema status posts like colon cancer or like some cancer of the waist down that affects the legs. But mostly, I would say 98% of my day is dealing with lymphedemas that affect the lower body.
Lower body. Well, and I mean, and it just affects, as the listeners know, and including you, like, it's like, it affects so much of their daily participation. I mean, there's pain associated, and there's, it affects their, ability to dress and ADL participation. So what are types of things that you see how, lower extremity edema impacting ADL participation and function?
Yeah, so that's interesting that you noted the pain. Most edemas, at least like lymphedema from venous insufficiency, it's not painful. Only like at the advanced stages, like a stage 3, maybe like end stage 2, does it get painful? Okay. And that's a problem because pain like signals your need for therapy. So a lot of these people come to me and they're like, I don't even know why my doctor sent me here. Like, my legs are just swollen. He said, like, it's not a big deal that my legs are swollen. But they send them here anyways because they know swelling is dangerous. Lead to wounds. So the most common complaint I get is I can't get my shoes on. I can't get my shoes on. I bought all these cool, especially the ladies. I bought all these cool shoes. Cute. I can't get them on. Right, and
that's when they go and see somebody. They're like, I cannot look amazing.
Yeah, or like, oh, my legs feel so heavy. I sit in my chair all day because like moving my legs, it's just so tiresome. Or getting my legs in and out of bed, like. That is when their lymphedema has progressed into the later stages, when it's hard for you to go from sit to supine because your legs are so heavy. So I think those are the major ones that I've had.
That you've had. Yeah, it's super interesting because like where I live in Western Colorado, so it's mountain town ski area, which is, I will admit, amazing, but you have limited resources. So like in the Valley example where I live, we have one certified lymphedema therapist.
Oh, wow.
Who's amazing. Yeah. And so otherwise they have to travel to a quote city. And I'm using that term loosely because it's not that huge, but it's 80 miles away.
Oh,
okay.
Wow.
So what I'm saying, what's super interesting is like you were talking about, like for me, when I end up seeing a patient, either, I typically see them in the earlier stages where they don't have the pain. They just, like you said, I can't get my shoes on. I can't do that thing. But also I end up seeing them because they haven't seen anyone, and they'll be like, my legs are hurting, or they'll be honestly like weeping, or you're like, how did you get to this point? But it's because there's, and then you're like, okay, now I obviously need to refer. Yeah. You know what I mean? So it's what's super interesting is like for me, it obviously depends on where you work in the area, and there's so many, factors that go into that. But like, it's really challenging because you have limited options. And so like a lot of times the physicians won't refer to the lymphedema therapist until they're like terrible. And so I'm like, this poor lady, this therapist has like, she only gets like terrible ones, like that are like, like you said, end stage, or where they're just having a hard time even moving. And it's just, it's tricky.
It is. So like the lack of resources with having the CLTs available to begin with, but also, like the MDs are our gatekeepers, and if they can control swelling, like with the way they're taught, like with medication, they're going to do it that way. So they're going to put them on furosemide, Lasix, like all those other water pills. And then we don't get them until it's like, well, that's not even working anymore.
Right. Do you find your people coming in saying that they just don't take their water pills? Is that a common thing? I hear that, but I may have different reasons. Now that I think about it, I have had a few tell me, like, don't. And even though I know, like, the water pills aren't, like, a panacea for the problem, it's just, like, putting a Band-Aid on the issue. Yes. Like, I will never tell a patient, like, they always ask me, because I kind of give them my 2 cents about water pills, and they're like, well, should I just stop taking them? And I say, no, absolutely not. Like, you take everything your medical doctor has you on. Like, you are on that for a reason. And I'll say something like, maybe once you show your doctor that you can control your swelling with these medical grade compression garments, and that you're doing your decongestive exercises, he could possibly put you on a lower dose, or like not increase your dose. And we know that even that is significant. Yeah. Oh, absolutely. And it's some of the challenges that I find is people, of course, so you're on these diuretics,
right?
And then they have to go to the bathroom more, right? Yeah. Which makes complete sense. But then there's such a combination. So they're taking the diuretics because they're swelling. Well, then they have to go to the bathroom more. Well, then they don't want to do that because they have to get up to the bathroom. And then there's like fall issues. And like, that's why we have to look at the patient so holistically, but it's so much more than just, I don't want to take a pill. It's like, they have those reasons, and I understand that. So it's like also trying from, like a generalist standpoint, trying to figure out, okay, so you don't want to have to get up to go to the bathroom 3 times in the night or whatever. And so it's like trying to adapt the environment, adapt the, oh gosh, there's just so much that goes into it.
Because I definitely get those complaints that like the water pills are just making it horrendous because I have to get up like every hour in the evening. But I try and tell patients, like, I just like reinforce, like, over time, like once you show your doctor that after this round of complete decongestive therapy that we're about to go through, like after you show him like your swelling is being managed and contained, he might like reduce your dose so you're not like having to go to the bathroom so often. And
yeah. No, I know it tends to be a little bit of a cycle. It depends always what their comorbidities are and what else is affecting, their daily function. Because then they'll quit. Some people I've had, they'll not want to drink any water then, or what I mean. It's like it's all those things. Like, it's those are the challenges. But so I'm very happy to. That's why one of the reasons why I was really interested in the topic. Just kind of wanted to see from someone who specializes in that kind of what their perspective is. So when do, let's say, okay, so if let's say you're just, quote, a general occupational therapy practitioner, as I am, and I see a patient, like when do you feel like it would be most appropriate for us to refer to a lymphedema therapist? Or when do we talk to the doctor and say, like, I really think that they should be going to a lymphedema therapist?
I like that.
Yeah.
So a few reasons. If you, like right off the bat, if you know they have a history of cancer or like any kind of cancer treatment, like especially radiation, removal of any lymph nodes, like ask them, have you ever gotten screened for lymphedema? Have you ever, has a doctor ever sent you to a lymphedema clinic or to a lymphedema specialist? Because even if they don't have lymphedema, it's so important that they see a CLT so they can at least, like just for an eval and treat, just for one session, so they can educate them on all of the preventive symptoms, exercises you can do to keep the muscles underlying that area that's prone to become lymphedematous strong to like help prevent an onset or an exacerbation. So right off the bat, like know their past medical history and whether or not they've had cancer treatment. If they haven't seen anyone, then definitely like that would be an indication to ask. Because with advanced age, like there's other things that can happen that can cause someone who's been lymphedema free 10 years after breast cancer to all of a sudden develop lymphedema. Like the research shows, like a lot, like that's a common misconception. Like, oh, like I had my mastectomy 3 years ago. You know, I have never had lymphedema. I'm not going to get it. Like, no, like some people will develop it 20 years after the fact. So that's the most important one. Number two, like what medications are they on? Are they on like any diuretics? That's an indication that, like obviously the doctor's trying to control their swelling the best they know how, which is with a pill. But it's not a panacea for the problem. Like the problem is the integrity of their like their venous system, especially if they have a lot of other heart conditions going on, especially like high blood pressure, any history of swelling. Like a lot of people will come in and tell me, oh, especially if I have a 9 a.m. or a 10 a.m. appointment, our office opens at 9. Oh, my legs are great.
Okay.
I don't know why I'm here. They're not swollen. Well, what happens with venous insufficiency, the swelling recedes overnight. So like right when they wake up in the morning, their legs look great. They're not pitting. To the naked eye, it looks like they don't have an issue. But over time, like as the day progresses and gravity has that like cumulative effect, like their legs are pitting at the end of the day, or like maybe a 1+. We grade edema like 1+, 2+, 3+. And depending on like when we press our thumb in, how deep the pit is, whether it disappears after 15 seconds, a minute. So that's like super important to tell the patient too. Like, yes, your legs may look great in the morning, but at the end of the day, like, what do you look like? So I never like take their word for it if I have an early eval, like, oh, my legs don't get swollen even at night. Like, well, I'm pretty sure they do, especially if you're on a diuretic. You just have to like be nice about it and not offend your patient. What else? So really, if like they have, like look at what they're taking, like look at their medications, and like subjectively too, like ask them if they've ever experienced any swelling. Now, like, especially if a patient has had recent knee surgery or shoulder surgery, like especially like within that 6-month post-operative time frame, they're still healing. And like the research shows we can accelerate the healing process and increase their range of motion with complete decongestive therapy, because swelling, like swelling that just like goes on and on and on, it's gonna like affect your range of motion and your healing. So also like, have they had any recent total like joint replacements too? We do get quite a bit of people with combined like causes of their lymphedema. So like they just had a knee surgery 3 months ago and they have venous insufficiency. So, I mean, we would treat both. So we, yeah, that's important to take into consideration, like whether they've had any trauma. And yeah, and also I guess the more common you probably, like any general OT practitioner, probably wouldn't encounter this, but obviously if they've had lymphedema, that's of a congenital cause, but most likely the doctor's going to already have sent the appropriate referral for that. So
Right. Yeah, that probably is not as common.
yeah.
But okay, I'm going to throw out a quick scenario. So, and these are some of my challenges. So I guess I'm just assuming that other people have very similar challenges. So let's say I'm working home health and you go and see the patient, and obviously you're getting a referral for something completely it's not for edema or anything like that. You're just because they're having difficulty with ADL participation or whatever at home. Okay. So so you go there and your lower extremities are very, swollen. They do okay, but they're not painful like we were talking about, but let's say they have a hard time getting their shoes on. So then they don't wear their shoes in the house and they have balance issues. And so we're like, okay, so it's a concern. I would say from my own experience, I personally wouldn't typically have referred to a lymphedema specialist at the time. So I would be like, okay, trying to figure out what are some things that I can do. And I'm just going to say as a scenario, they don't have, a history of cancer. They're not, it's not painful. They're quote, just swollen. Okay. So like from a generalist standpoint, like I said, I wouldn't probably refer to a lymphedema specialist because one, my home health patient can't get to one,
Right.
Okay. And so what is best practice, I guess, for treatment strategies? I know we have to look at contraindications sometimes about, like heart issues and all those different things before you start. But like, what would I do in that? Or some recommendations?
Yeah, that's a great question. First of all, you want to keep the lymphodematous or at-risk legs spotlessly clean. So teach them how to use long adaptive equipment, especially like in between their toes, around their feet. Like I find like past the ankle is really hard for our older adults to keep that way. So like really teaching them how to keep their legs not only clean, but like rinsed and dried. So no fungus grows. Like fungus and lymphedemas related to chronic venous insufficiency. Like they pretty much go hand in hand. And also I think it's just like a lot of seniors have toe fungus. Around like metatarsus area. So just teaching them like how to prevent that and keep it clean. And also like you as a generalist, maybe I should throw a disclaimer, like check your state practice act, but
good one.
If we see fungus, we treat it. Like we'll clean their feet, clean their legs, dry, and we all have our own stash of like antifungal cream. So we'll teach them like, oh, this is like, we need to do this to like help get rid of the fungus, like over-the-counter antifungal cream. Nothing fancy. And like apply it with, gloved hands and a Q-tip. And then we'll do that underneath their lymphedema bandage. So I'm pretty sure most general OTs can learn how to look for fungus around the feet. Like different kinds of fungus look different. Like some of it looks white, some of it looks yellowish. So cleaning it. I just use like a hot, warm, soapy water and a washcloth. Kind of like gently debride it. Rinse, dry, and then I'll like put the antifungal cream on. So that, just teaching your patient, like it's so important to keep your swollen leg clean. And then like explain why, because a lot of people don't get it. Well, when you have swelling, like your skin breathes through oxygen and like it gets that oxygen through your blood. So when you have all this swelling between your vessels and your skin, Like the nutrients and the oxygen have to travel like tenfold, like just with like a 1 millimeter or 1 centimeter increase in edema. So you can only think about how much farther the oxygen has to travel and the nutrients when a limb is very swollen. So it's prone to like all these infections if you bump your leg against the coffee table or get like the dog scratches you the wrong way. So yeah, you don't want to like keep like skin checks, make sure you have no cracks in there. But yeah, really explaining why, like explaining how your skin breathes and why you need to keep your limb clean. That's important. So if the skin is super, super dry, what do you do about it? You hydrate it. So teaching them about like how to put the lotion on. Like, no, it's not just a cosmetic issue that your skin is flaky and dry. Like a lot of my men, like I have to really emphasize that because they don't really care that their legs are dry like women do. Like, no, this is an issue. Like, let me show you some of the lotions. We use like Walmart brand Equate. And for some people that works just fine. For other people, they need something heavier, like a cream. So like Equate, Walmart brand sells a cream, Equate cream. When I became a lymphedema therapist, they really pushed for us to use like higher end products like Cetaphil, Eucerin, and like, you know, for people that have like moderate or worse dryness, like those more expensive products are better and I use it, but some people can just get away with like Equate Walmart brand lotions and creams.
Yeah, also obviously depending on the patient's
their
financial situation.
Yeah, you got to take that into consideration too.
Yeah. Okay, so you've taken care of the skin itself. Like we've done the fungus, we've cleaned it, educated the patient, hydrated. Okay, what would be the next step?
Keeping your skin, like don't expose it to extremes in temperature, like extreme hot and extreme heat. Keep it protected from the sun, because we know like that, you know, that increase, like extreme temperatures causes like hyperemia. So the blood vessels to dilate and cause more swelling. So avoiding like hot saunas and hot tubs would be another great preventative measure in order for it not to get worse. Exercise. Like a lot of the decongestive exercise certified lymphedema therapists learn in these courses, they're very similar to the exercises we're already doing with our patients that are weak and debilitated and just had surgery. So really strengthening and keeping those muscles that lie underneath the swelling strong are important because it like creates I do so much better explaining this in person, but if you think like
I know.
skin, like the skin covers the fascia and like everything underneath it, and then you have the muscle pump, so like it's contracting like with exercise. So then on top of the muscle and below the skin is all the fluid, or at least the superficial lymphatic system, which sits above the muscle. So when you are engaging in that exercise, that's so good for helping to get the lymph fluid out.
What kind of exercises do you recommend?
So for my patients that are super fragile and older, I like to keep it super simple, like no more than 5 exercises. 5.
Okay. I say keep it simple. I agree.
Yeah, that might even be too much for some people. Normally I'll start out with like ankle pumps, like supine in bed with the head of the mat elevated. Ankle pumps up and down, like ankle circles, ankle circumduction, heel slides. So like sliding your heel, like if you're supine long, like you would slide your heel from the end of the mat table, and then keeping the heel on the mat table, slide it as close to your buttocks as possible, and then slide it back out. So that's like engaging your hamstrings and your hip flexors, which is really good. And what else? Short arc quads, I like for some people, especially those that have like really bad arthritic knees that can't do like the long arc quad, like sitting, just to engage the quadriceps a little bit. I'll put like a bolster under their knees and just have, do that simple knee extension. Like really, those are like my go-tos. I'll also have them do diaphragmatic breathing, because we know that deep belly breathing is so good for the lymphatic system and just for anyone in general, like changing the state of your nervous system from that fight or flight to a more calm parasympathetic state. I'll teach them how to do like self-resisted diaphragmatic breathing. So like putting one hand on top of the other on top of their navel, taking like a deep inhale through their nose for 4 seconds, and then a deep exhale through pursed lips. And while they're exhaling through pursed lips, I'll have them apply like downward pressure through their hands that are on top of their navel. And that helps like to engage and empty out that abdominal cavity that has all of those lymph vessels and all the lymph vessels in like that area. They're taking up all that lymph fluid from the legs. So like a lot of the techniques we do on their abdomen are super important, because a lot of our patients suffer from lower body swelling. So we like work a lot on their abdomen. There are some contraindications for like abdominal techniques, so I take that into consideration as to whether or not I'm going to teach them that exercise. So like recent abdominal surgery within the past year, like diverticulitis, like pregnancy. There's a few other ones, but I would just be super careful if you're going to teach your patient to resist the outward and upward moving of your belly, applying resistance downward. Like if you have any doubt, I would just have them like do the diaphragmatic breathing without pressing into their belly with their hands, like just to be safe.
Yeah.
Yeah.
Okay. How about what is your take on TED hose, or because what I find happens is people just don't know what to do and they just end up putting them on, and we have to have a doctor referral and that kind of thing, or doctor order, depending on what setting you're in and that kind of thing. But any thoughts on TED hose?
That's a really good question. We get a lot of people, well, not a lot, but I have seen some people come in and like I'll talk about our protocol and what we do in terms of training and fitting for medical grade compression, and they'll be like, oh, I have a pair, and they'll pull out their TED hose, and I have to tell them those aren't appropriate. They're appropriate for when you're lying supine in bed and, for general prevention, but they don't deliver the strength of compression that like everyone needs. Because when you're laying in bed, like you don't need as much compression as when you're standing, sitting, walking. Because you have to like fight the force of gravity now when we're talking about those positions. So I pretty much tell my patients, I'm sorry, but you're still going to have to buy medical grade compression. Like those TED hoses aren't going to cut it. Especially if they have any type of lymphedema, because lymphedema is not the same as edema.
Right.
Like you need something strong, like a class 2. Like a level 2, we grade like compression levels like in classes, and if you become a certified lymphedema therapist, like they go over that with you in the course. So most of our patients get put in like a 30 to 40 millimeters of mercury class 2 medical grade stocking. Ted hose, I think, delivers like less than 10 millimeters of mercury. I'm not exactly sure, but it's...
And they're still hard to put on.
And they are still hard to put on.
I know. Okay. How about, I'm trying to think of some other things that people have used. I'm thinking lower extremity versus, upper extremity, but how about kinesio tape or, some of those kinds of things.
That's a good one. So we actually have a certified kinesio tape practitioner. She's my partner. I'm the evaluating occupational therapist, and she's the OTA. She's also a certified lymphedema therapist. She is amazing with the tape. I use it. I'm not a certified kinesio tape practitioner, but I've been CEUs, so I still feel like comfortable and confident with applying it. Like, you don't have to be a CKTP to use kinesio tape.
Right.
So yeah, we use that quite a bit. Actually, all 4 of us here in the office use it, just to give the patient a little bit extra if we're noticing some like stubborn areas of residual swelling. We'll use like that lymphedema, like edema fan technique around those areas. Yeah. And it really works great in combination with the lymphedema bandaging. So I use that stuff.
Yeah, I'm a big kinesio tape fan as well, and had such really good results with it. And it's the same type of thing. You have to check your state regulation on what, you can and cannot do, of course, with all of this. But, I'm just trying to think of like some ideas, like I said, from a generalist standpoint, like, okay, so what, teach them some, exercise, go over skincare, skin checks, hydration, obviously, if the doctor has prescribed Ted hose, we're going to be teaching them how to put them on and doing that whole thing. Kinesio tape. I'm just trying to like fill someone's toolbox.
Of course.
Of like, what are some ideas? Because I think sometimes people get a little stuck. Like, you're like, oh my gosh. And then I think the other is there anything else that you think would be a good?
There's
tool?
A lot of other things. You can avoid teaching your patients to avoid any type of trauma. Again, not all trauma is avoidable, but cuts, insect bites, cat scratches, like I said. So I tell like all of my breast cancer lymphedema patients, like, keep an alcohol swab in your purse with like some Neosporin and a Band-Aid. Because even something as simple as a mosquito bite can cause a lymphedema exacerbation. So I would probably, I'd recommend the same thing to my lower body patients too. I don't, it's not as intuitive, but like teaching them how to have those disinfectant tools like on hand, so they can like prevent any like inflammatory reaction turning into an edema is important. Also, if you know that your if you're treating someone for something like ADL related and you notice in their past medical history they have like a breast cancer or something, and you know that they travel by air, it is so, like, it amazes me how many people don't know this, like doctors. Like, it's so important that your patients have a sleeve for prevention if they're going to get on a plane, because the atmospheric pressure in a plane is different than on Earth. So a lot of people get, like, they blow up on the plane. They get swollen if they don't have their sleeve on to prevent a lymphedema exacerbation.
That makes complete sense.
Yeah, most doctors are pretty good about it. Like they'll ask, like, do you do any air travel? And they'll make sure their patient gets a sleeve. But that's so important. So knowing, like, the past medical history of your patient. If you're like wanting to be super extra cautious, you can do things like recommend an electric razor for your patient as opposed to a regular razor, because that's not going to cause nicks and cuts that can become agents for infection. That's like more extreme, but like if you were worried about infections developing into a swelling, you could recommend that.
Yeah, it just, absolutely depends on the patient, of course. I mean, like some people you definitely are like, yes, you definitely need an electric razor,
exactly.
So yeah, I can totally see
really
that.
being aware of the signs and symptoms of a DVT or cellulitis, so you can teach your patient how to be aware of those signs and symptoms so that they can advocate for themselves and like call their physician, go to the hospital, get it taken care of. Because we know that people that suffer from swelling are more prone to cellulitis. So like if skin feels hot, looks hot, some people may develop a little bit of a fever, like their skin's painful. Like it's so important like that they get on antibiotics, like tell them like that is not something you let go. You need to call your physician. Because that can turn into something life-threatening. Maintaining an ideal weight through a well-balanced, low-sodium, high-fiber diet, avoiding smoking and alcohol, all those things that we already know as therapists, like that's critical to keeping your lymphedema at bay. And for some of our patients, like that's super hard because they already come to us with obesity. But we know that obesity just makes it harder to control lymphedema. So if you can like really use that as a push to help your patients like develop and maintain a healthy body weight, like no, this is going to help your lymphedema. That's good to push too. Also, there's a big misconception that since lymphedema is a high protein edema, that's what makes it different than regular edema, that you should avoid eating as much protein like as average as you should. And we know that's not true. It'll actually like weaken the connective tissue and worsen the condition. So I'm recommending things like easily digested protein like chicken, fish, tofu, but really they need to be eating protein. Like, yes, lymphedema is a protein-rich swelling and edema is just water, but you still need protein in your diet.
It's great that you say that because it's one of those things that you feel like sounds so obvious, but the things that I think sometimes people don't educate patients on those things, on those topics, because they just assume that everybody should know that. But those are things that people really need to know.
Yeah, definitely. I was going to say something too. Seeing a podiatrist once a year is super important, for prophylaxis, to check for and treat ingrown toenails, calluses, pressure areas, especially fungus and athlete's foot. Making sure your patients understand they need to wear clean socks. Because if they're cleaning their foot and they're just putting on a dirty shoe again, like that's not really doing them any good. Using talcum powder on feet, especially if you perspire a lot. That'll just make it easier to pull on compression stockings. And also like avoiding tourniquet effects. And I have to educate on this a lot. Like teaching patients that it's not okay to keep wearing that sock or shoe that leaves a huge humongous 2-inch mark in your skin. Well, that's cutting off your circulation. You don't want to do that. So I would tell them, don't trash it, but let's not wear it, and maybe we'll revisit whether or not it's appropriate after you're done with your therapy.
Yeah. That's actually really hard for people because people have their special, their socks that they like to wear, their routine. I have my own, and it's like, honestly, when I fill in at skilled nursing, the number of socks I end up taking a little scissor and cutting little tips at the top so it's not a tourniquet.
Yeah,
you know what I mean?
That too.
Yeah. I'm like, you have to, because one, they usually only have 4 pair, and I'd say most of the people are okay with it, and if you're educating why. But yeah, and then their favorite shoes, and it's amazing how they can even squish their little feet in those shoes because, of course, at the beginning of the day, like you're saying, they're doing okay, and then it just swells, and they take off, and it's like that big old bubble on the top of their foot, and they're like, oh, it doesn't even hurt, and you're like, oh my gosh, it looks awful, it doesn't, but Yeah, it's education.
Yes, education is so key to this population. And one last plug for prevention: making sure they understand that they need to avoid injections, blood drawings, and blood pressure readings on the affected limb. That's important too. They'll have the doctor or nurse take it on the other side. A lot of times patients know that, but they just completely forget to tell the nurse or doctor when they go in. And they'll panic to me. They're like, oh no, I let the nurse or doctor, do my blood drawing on my, the same arm I got all those lymph nodes removed. Most of the time it won't do anything, but it does pose a risk. So try and have your patient, always be aware of advocating for themselves when they go for a checkup.
Yeah. No, those are great tips. Those are things that, like I said, it's just a lot of times we know some of these things, but it's so nice to kind of get a little crash course on things that we should be looking at or things that we should be educating our patients on. Yeah. So, and you have included for all the listeners a whole slew of some really great resources that I'm going to be including in the show notes. And so what are these resources that you use, or what kind of resources are they?
So one of them is from a really popular compression manufacturer that we recommend stockings for, Medivan. Them and Juzo, they're really popular, but the Medivan resource has a bunch of information about the etiology of lymphedema and how the blood circulatory system works. So I kind of like to use that one for every once in a while. I'll get a patient that's just super body aware and super curious. I try and educate all my patients about how your body naturally manages fluid, the interrelationship between the blood circulatory system and the lymphatic system. But a lot of times they just like to have that hard copy, so I'll print that out for them.
Yeah. Yeah, something to refer to.
Yeah,
it's so great. Yeah.
I think the other resource on there was talking all about prevention, so prevention strategies.
Mm-hmm. And there was like a lymphedema Q&A. I mean, it's a good little packet. I mean, it's good for the therapist, but it's also really good resources for the patients.
And then one of them went into depth about venous insufficiency.
Yeah. Perfect. So all those resources that Mandy has provided for you will be in the show notes. And then I'm also going to be providing a diaphragmatic breathing patient handout. So you can print that off and give that to your patient as awesome. Well. Yeah, I know. It's like all those little things, really, like I said, I love filling the toolbox of handouts and resources and things like that. So it really just helps. But anyway, let's wrap this up. Is there anything else that you need to make sure that everyone knows about the wonderful world of edema?
I wanted to tell you, if you notice that you have someone you're mentoring or a coworker that works for a home health agency, and you're getting a lot of referrals for people, and they might not necessarily be for edema, you as a therapist, advocate to your company and see if they will at least pay 50% of the funds for you to become a certified lymphedema therapist. Because a company I used to work for in Tampa, they used to call all the time asking if our home health agency had any CLTs on staff, because it's so hard to find CLTs on staff that do home health. So I think your boss or whomever is your supervisor would be susceptible to it if you just mention it. Hey, I get a lot of referrals for this, but I'm noticing this, we could really make an impact here. My coworker got her employer to purchase or take care of half the cost of the training, and some will just foot the whole cost. So if it's something you're interested, please bring it up to your employer.
That's a great idea, because like I was kind of referencing earlier, it's when you do home health, they're homebound and they're not able to travel. And so you're kind of struggling as a treating OT practitioner, trying to figure out what's the best for them, because that they can't get to the CLT. So you're okay, what can I do? You know what I mean? And so, yeah, I think having home health agencies do that, that's a great idea. Never thought of that, but yeah, perfect. Well, I appreciate you so much for coming on today and talking about this.
It was my pleasure.
And yeah. Oh, no problem. Thanks everyone for listening. And until next time.
Hi guys, don't forget to check out the live courses from my sponsor, Great Seminars and Books. I love the variety of courses they offer, specifically because they are relevant to the populations that we are working with every day, older adults. And their topics include things such as home health, a specialty course of its own, and clinical implications of pharmacology for the therapist working with the older adult. So all these topics are relevant, evidence-based, and very practical. These are treatments that you can learn in the course and take back and use right away. So head on over to seniorrehabproject.com/great and use my promo code SRP25 so you can get $25 off your next live course.
This podcast is brought to you in partnership with the Senior Rehab Project at seniorrehabproject.com.